Now that we're a year into the COVID-19 pandemic, we're beginning to have an understanding of the lasting, long-term effects the disease has. While we continue to learn more about the physical, long-term complications of COVID-19 on patients, we're also learning about the psychological toll of the disease on patients, healthcare providers, and the general public. Neuropsychiatric symptoms appear to be common with COVID-19 patients. One recent study suggests COVID-19 patients have an increased chance of developing a new mental health illness within 90 days of diagnosis, compared to other illnesses such as influenza. Patients who were admitted into intensive care are particularly susceptible to developing mental health issues. For example, one study found up to 22% of patients who were admitted to a hospital for COVID-19 developed symptoms of anxiety or depression, and up to 38% of patients admitted to intensive care developed the same symptoms. Other psychological symptoms that patients may experience include confusion, insomnia, decreased memory retention, and poor concentration. Critically ill patients also appear to be susceptible to developing post-traumatic stress disorder or post-intensive care syndrome. Healthcare providers have been particularly at risk for psychological distress during the pandemic, particularly healthcare professionals who spend a significant amount of time in direct contact with patients, who have been quarantined, and those whose workplaces don't have sufficient personal protective equipment. Healthcare providers who face social stigma because of their profession, who don't receive sufficient time off, or who do not receive clear communication from superiors may also need extra psychological support. Studies of healthcare workers in both China and Italy reveal that almost 50% of healthcare workers experienced traumatic distress during the pandemic, up to 25% experienced depression, up to 20% experienced anxiety, and up to 8% experienced insomnia. In Canada, almost 50% of healthcare workers indicated they needed psychological support during the pandemic. Healthcare workers can decrease their likelihood of developing psychological distress by getting regular physical exercise, seeking psychotherapy services, talking with colleagues or support groups, or practicing meditation. Staff should keep an open dialogue with their managers on how they are coping with the pandemic, so managers can attempt to accommodate needs their staff have. Children may be disproportionately affected by the pandemic and social distancing efforts. Children may experience anxiety, depression, and insomnia caused by disruption to their routines, closure of schools, inability to see friends, and exposure to concerning news stories they see in the media. Many children are experiencing increased screen time to accommodate schools transitioning to virtual learning, as well as to stay connected with friends and family. Younger children have limited understanding of the pandemic and limited coping and communication skills. They may be unable to share their concerns and feelings to others. As a result, younger children may be more prone to defiant behaviors, or be more irritable, have decreased attention spans, and may experience developmental regression such as thumb-sucking or need for additional parental attention. Spending additional time with children, increasing affection, reducing exposure to media, refraining from pandemic discussions with others around children, and encouraging video chat with relatives are all potential strategies to help reduce pandemic stress in young children. Children who need to be quarantined are at significant risk of developing mental health issues. For example, research suggests quarantined children have up to a 30% chance of developing post-traumatic stress disorder. Quarantined children should have regular contact with their parents, be encouraged to continue their daily routine, and should have contact with a mental health professional if possible. Adolescents also will be disproportionately affected by social distancing efforts. Teenagers and young adults have high energy levels, increased desire for new experiences, are highly motivated to have social experiences, and crave social interaction with their peers, making it difficult for them to remain isolated. Adolescents may find social distancing efforts frustrating and boring, and increase feelings of isolation from their peers. If possible, parents should encourage teenagers to set regular video calls with friends and family, Get daily exercise outside, avoid frequent or long naps, and encourage them to avoid screen time before bed. Engaging teenagers about their feelings will also help them cope and process any social isolation they may be feeling. Healthcare providers who work with children should look for signs of domestic violence, emotional abuse, neglect, or child exploitation. That's because stressors on parents or guardians due to financial and social instability, fear of the COVID-19 virus, and boredom have increased domestic violence by over 300% in some areas. This vigilance is particularly important for children who have a history of mistreatment at home or who have existing mental health issues. Social distancing efforts further isolate at-risk children, and the increased parental contact from staying at home increases the likelihood for further abuse or conflict in the home. Healthcare providers should also be mindful of the increasing stress parents experience, particularly if they have young children. Changes in children's behaviors related to the pandemic may leave parents feeling inadequate as caregivers. Parents may benefit from healthcare providers using supportive language, suggesting support groups, or suggesting other strategies that may help them cope with the challenges of parenting during lockdowns based on their own experiences or experiences of those they know. The general public likely experiences stress both directly and indirectly from the pandemic. The pandemic is a novel, dangerous threat to the safety and well-being of people and their loved ones, which may contribute to anxiety and create fear of the unknown. The restriction of movement in countries can feel socially isolating to many, which may increase the risk of depression. Many businesses have been disrupted or forced to permanently close, leaving workers temporarily unemployed or unsure if they will return to work at all, putting significant financial strain on them. Studies have described the impact on the mental health of the public. In China, 29% of adults surveyed experienced moderate to severe anxiety, and up to 17% experienced depression. Another survey indicated 36% of Americans felt the pandemic had a serious impact on their mental health. This general stress may be linked to worsening substance abuse or substance abuse relapse, with a survey from China revealing up to a 32% increase in alcohol consumed by individuals who drank regularly, and an almost 20% increase in individuals who previously abused alcohol relapsing to alcohol abuse. While social distancing is an important and effective strategy at slowing the transmission of COVID-19, it has a significant toll on the mental health of people. The general public should make extra efforts to stay connected with friends and family while still physically distancing, such as setting up regular video calls or having virtual game nights. If quarantining becomes necessary due to COVID-19 illness or exposure, it can help to have healthcare providers explain the purpose of quarantining and give suggestions on best practices for correct quarantining in order to improve adherence to quarantine guidelines. Quarantining should be communicated as voluntary but strongly encouraged, and emphasis should be placed on the need to keep others safe through quarantine efforts. Also encourage patients to lean on their social network to help them get household supplies and food. Ultimately, the best management of mental health problems caused by the pandemic will be to prevent further spread, such as by wearing a mask and getting a vaccine when it becomes available. In summary, the COVID-19 pandemic appears to be having a significant impact on the mental health of patients, healthcare providers, and the general public. Patients diagnosed with COVID-19 are at much higher risk of developing new mental health illnesses. Healthcare providers are facing challenging working conditions, with many of them experiencing distress. The general public also is experiencing decreased mental health due to direct and indirect impacts of the pandemic, with many people feeling their mental health has been severely impacted. Young children in particular are struggling with the changes to their routine, and teenagers may be disproportionately affected by social isolation.